Hi everyone, this is Dr. Corolla Okogbaa again. I am the CEO of Louisiana Center for Eyes in the Baton Rouge area, and we help individuals achieve their best vision and help maintain their sight. And so today, as you have seen in some of our previous videos, we're addressing macular degeneration, which is a leading cause of vision loss in individuals over 50 in the United States, and so it can cause blindness, and it's a very common condition. And so today, what we're going to talk about is, well, what do we do about it? Okay, so in our previous videos, we talked about who's at risk for developing macular degeneration. We talked about if you smoke or if you have a family history of smoking. If you're a Caucasian, you have a higher risk of developing this condition. We talked about the importance of getting routine eye exam. We talked about how macular degeneration impact your central vision or the macula, and so it causes the vision to be blurry more in your center vision, unlike other things like glaucoma that tend to affect your peripheral or side vision. Okay, we also talked about that there are two main types of macular degeneration, what we call the dry age-related macular degeneration or the wet type. About 80% of individuals who have macular degeneration tend to have what we call the dry type, and the rest tend to have what we call the wet type. So the question is, can vitamins help me? We'll kind of go over some of the treatment options and what we do to kind of help you maintain your vision once you've been diagnosed with macular degeneration. So for the dry type, really we don't have any treatment, but there's certain things that can really slow the condition. One, if we catch it early, like anything else, we can monitor the vision with what we call an Amsler grid, where your doctor will give you this grid that has horizontal and vertical lines, and you monitor any subtle changes, curvy lines, missing lines, and those things will prompt you to come in sooner because the vision loss can be subtle. And so, because sometimes it could mean that this dry type is converting to a wet type, and we want to really catch it if it starts to worsening. So that's one of the things to monitor the vision once you've been diagnosed with age-related macular degeneration. Now, vitamins. Now, this is a condition, particularly for the dry type, that we actually recommend vitamins. Okay, why? Because we've actually had studies, AREDS studies, AREDS studies that specifically looked at certain combination of nutritional supplements, and they found that actually really help slow down age-related macular degeneration, particularly the dry type. But I say, whether you have dry or wet, take your vitamins for macular degeneration. And there's a specific formula that was studied, and they found that, yes, that combination actually really help, okay? Obviously, eating well, a well-balanced diet, fish, dark leafy vegetables, dark leafy greens, your fruits and vegetables, all these good things also help in this condition. And obviously your overall eye health, it's good to eat a well-balanced meal. Now for wet macular degeneration, we actually have some medications that really help to slow the vision loss and to help you keep your sight. The biggest class of medications that help with wet macular degeneration are called anti-VEGF medications. So usually if you know somebody who has macular degeneration, they're seeing the eye doctor, and they may be getting this medicine that is placed inside of the eye with a very thin, tiny needle right inside of the eye. You actually have to give that medicine, and what it does is it reduces the abnormal blood vessels that form there, and slows down all that leakage and what we call edema or swelling that may cause that vision loss. Okay, so yes, so there continues to be a lot of research and different medications and coming up for this condition. But at the end of the day, what's important is for you to make sure you maintain your eye health by, first of all, getting an eye exam. So if you have not gotten one this year, 2022, please put it on your calendar, make an appointment. Or if you've not had your eyes checked at all, or if you know anyone who have macular degeneration, please, you know, help them to make sure they see their eye doctor. If you happen to be in the Baton Rouge, Louisiana area, we'd be happy to help you. So come on by, call us, or stop by our website at www.lacenterforeyes.com, and we'd be happy to have you make an appointment for a consultation, get an eye exam, and see how you can maintain your eye health. All right, thank you. And that's been another Eye Health Minute for you. All right, take care. Bye-bye. Hi, everyone. This is Dr. Corolla Okogbaa again, coming to you today on this lovely day. And today we're going to discuss about refractive errors. So I'm here to talk a little bit about eye health. I am the CEO and founder of Louisiana Center for Eyes, and we help individuals achieve their best vision and help maintain their eyesight so that everyone can live their best potential life. Okay, and so today we're gonna address some common things that most people come see the eye doctor for, for an eye exam, and we do a full comprehensive eye exam, and there's certain terms that we use to describe what's going on with your vision. And so some people will come in and say, Doc, I cannot see a thing a few feet away. I'm good close up, but far away I cannot see a thing. What is that? Okay. And so if you've ever heard someone say the phrase, you are so myopic. Have you ever heard that before? And have you ever wondered what that means exactly? You're myopic. Well, today you're gonna learn what that word means, myopic. Okay, so let's first talk about how the eyes work. So if I'm looking at a computer screen, how do I know how does that image go from out there into my eyes, into my brain? Okay, and so when we're looking at something or an image, the front part of the eye, which is the cornea, and inside the eye have the lens. Both of these structures refract or bend light, okay? So they bring the image and positions it on the retina, which is the back of the eye. And then from the retina, that image goes to your brain, where your brain interprets what you are seeing, okay? So in what we call a normal eye, where there's no issues and all the curvatures are great, the image will be presented right on the retina, okay? So that's normal 20/20. You can see far away, you can see close up, you're good, okay? Now, there are certain circumstances or instances where where the image, okay, so if you're nearsighted, that means that the image, as it comes into the retina, does not quite get there. It falls short of getting to the retina, okay? And so we call that short-sightedness or nearsightedness or myopia. If the image bypasses the retina and goes a little bit further out, well, we call that farsightedness, okay? And so we call these in general refractive errors. And so another refractive error is what we call astigmatism. Okay, and that has to do with the curvature of the eye, particularly the retina. I'm sorry, the cornea or the lens. They have different curvatures, and so we want in a normal eye, the curvature tend to be more round, like a basketball, we would say. And then when you have astigmatism, well, the shape is different. It's more oval, and so it's not bending the light properly to the retina in any distance. So that means when you have astigmatism, your vision is blurry close up as well as far away. Okay. And so the next question is, well, what are some of the symptoms? Well, obviously, if you're nearsighted, like I said before, you see better close up and not so well far away. And then if you are farsighted, that means you see better far away and not as good close up. And so many times people aren't sure what they have until they go for an eye exam and the doctor's telling you, well, you are nearsighted or you're farsighted or you have astigmatism, and then we go from there. Obviously, once we know what's going on with the eyes, we tell you what's the treatment. Well, we want to correct. So I'm nearsighted, so I am wearing a corrective lens to correct my myopia or nearsightedness. We have eyeglasses, other things. Contact lenses can help with both myopia, hyperopia, and astigmatism. And obviously, surgical correction is an option as well with LASIK, what we call refractive surgery, such as LASIK surgery to help with removing the myopia and making the vision, helping the eye to bring that image right to the retina, and in many cases not have to wear glasses or corrective lenses at all after those type of surgeries. Okay, so just want to let you know about some basics of the eye, how the eye works, and why do we have nearsightedness and farsightedness. Many times we're born like that. And many times we don't discover what we have until later in life. Some people, it's earlier on when you are a child. And so we call these refractive errors. Now, if you have not had an eye exam in a while, or you haven't had your yearly routine exam, it's time to call your ophthalmologist and make an eye exam. Just check on the eyes, make sure, and just do your annual or comprehensive eye exam. If you happen to be in the Baton Rouge area, in Louisiana, stop by our office, give us a call, check us out at www.la Center for Eyes, and we would be happy to help you take care of your eyes. Thank you. Bye-bye.